What role do environmental factors play in preventing TB? Imagine your surroundings as a shield that can either help keep tuberculosis bacteria at bay or make it easier for them to spread. Environmental factors are a big part of how we prevent TB from taking hold or spreading further. Clean, fresh air is essential because, when the air is polluted with dust, smoke, or tiny particles like PM 2.5, it can weaken your lungs' defenses. This makes it easier for latent TB infections to turn into active disease. People exposed to occupational dust or secondhand tobacco smoke are at higher risk, especially children. Using cleaner fuels for cooking and heating can also help reduce exposure to harmful smoke that might increase TB risk. Living and working conditions matter a lot too. Crowded, poorly ventilated spaces, like cramped apartments or overcrowded workplaces, allow TB bacteria to linger in the air longer. Since TB spreads through tiny droplets in the air, better ventilation can dilute these particles and lower the chance of inhaling enough bacteria to get infected. Improving airflow in homes, schools, prisons, and workplaces is a simple but powerful way to cut down transmission. Reducing overcrowding and ensuring enough space between people can make a real difference. Socioeconomic factors are also part of the environment that influences TB risk. Poverty often means poor housing, limited access to health care, and undernutrition, all of which weaken the immune system and increase the chance of infection or disease progression. Improving living conditions, providing better nutrition, and ensuring access to medical care are vital steps in preventing TB. Climatic and regional environmental factors like temperature, humidity, and sunlight exposure also play a role. For example, high humidity and certain weather patterns can influence how TB bacteria spread or survive in the environment. Recognizing these patterns helps public health officials plan targeted interventions, especially in regions with higher TB rates. Practical steps to reduce TB risk include improving ventilation in homes and workplaces, avoiding exposure to tobacco smoke and occupational dust, and tackling pollution sources. Addressing broader social issues like overcrowding and poor housing is equally important. When public health strategies incorporate environmental improvements alongside medical efforts, we can make a bigger impact on reducing TB worldwide. In the end, environmental factors are a key part of TB prevention because they affect how easily bacteria spread and how likely latent infections are to become active. Protecting air quality, improving living conditions, and addressing social determinants are all essential tools in the fight against tuberculosis. Always remember to consult healthcare professionals for personalized advice and stay informed about the latest public health guidelines.